Hello, and welcome to another edition of the PT Chronicles. Today, we're going to talk a little bit about chronic pain. Many of us, we have pain. We've either done something, we've moved something, we've lifted something, we've twisted, we did too much activities, something like that, and we have pain and we think that, oh, okay, well, I just tweaked it or I moved the wrong way or it's just sore and it should go away soon. Unfortunately, for many of us, the pain doesn't go away soon. It continues and it continues, it continues, it lingers. And now we are 3, 4 months down the line and we're still having this pain. And unknowingly to us, there's something that needs to happen. And so what we're going to talk about today is chronic pain. So acute versus chronic. Acute pain is something that just happened. So that initial injury when you first hurt your shoulder, your knee, your foot, whatever, that is acute pain. So that's pain right after the injury. There may be swelling. There may be increase in temperature. It's going to be hard to move. You may wrap it. But what happens is once we get into that 3 to 6 months period, this has now become a more chronic issue. And maybe it doesn't bother you every day. Maybe it only bothers you with certain movements, range of motion, but it's still a source of pain because when you get to that end range or when you do that particular activity, the pain comes back. And it may be a short cycle of where there's some swelling, there's some heat in the tissue, and you have to do something to reduce it. Or it just may be something that's kind of lingering there all the time, not severe, but irritating. That would be more of your chronic pain. And what I want to talk about today is chronic pain and how it affects our life. So when we have acute pain, if it gets better within that short period of time, 3 to 6 weeks, then we're like, oh, okay, we can go back to our normal life, our daily activities. We can go back to doing things the way we were doing them before. So we can function as normal. However, when the pain becomes more chronic, we end up not only compensating to kind of take the weight off or the pressure off, but we change how we do things. So if it's our ankle, we're going to change the way we walk. We're going to change the way our knee flexes. We're going to change the way our hip functions. We are even going to um, make some changes up into the spine, the hips, the low back. You'll see changes there. So sometimes, and I've mentioned this before, that people say pain moves, and pain doesn't actually move. It's just that through compensations, through the way we've changed our body mechanics so that we don't feel pain, that we cause pain or injury or stress somewhere else. So, thus, it feels like the pain has moved. And with people who experience chronic pain, they may start off limping, but then that limping becomes a habit. So, I want to tell you guys about a quick story about a patient that I've recently seen and what happened with her. So I had a lady come in and she was a referral from another patient that I've been seeing, and she's been having some knee issues. So this young lady, she has a manual job. So she's a house cleaner. So she's up and down on her knees, she's back and forth, she's moving around. So most would say she's active. She's active with her work duties. She's not sitting at a desk most of the day or driving in the car long distances. She's up and down stairs, back and forth moving. And she had had some chronic knee pain. She had been getting steroid injections for her knee for about 3 or 4 years. And the injections were decreasing the pain, but not eliminating the pain. And so she came to us because the last injection that she had, which was maybe a week prior, didn't do anything. So oftentimes we see with patients that after several injections, several series of steroid injections, that it stops having effect. So the first couple of ones may be really good. They may feel great. You're getting some relief, but the more injections you have, the less changes that it does to the tissue. So, like with this young lady, as I said, she's been having injections for a while, and this one didn't really do anything. So when I saw her, her knee was pretty swollen. It was hot to the touch. Um, it appeared as an acute injury, like she had just injured it. But this is something she had been dealing with for years. It had got to the point that even when my dog is trying to get in the picture, Harley, it got to the point that even when she was vacuuming, she expressed that with vacuuming, if the cord touched her knee, it would cause her great pain. So, so that's what she was coming in for us for because she was having pain with everything that she was doing. So we did, as you know, with our clinic, we do traditional therapy, but we do some non-traditional holistic options as well for therapy. We have the MLS laser that we used on her. We also did dry needling. We did myofascial release, along with some traditional exercises and manual therapy. Prior to starting, she said that her pain was a 3 out of 10, which isn't bad. She reported she feels that she has a high pain tolerance, so 3 out of 10 is not bad. We After the end of the session, she got up and she was laying there and she was surprised that she wasn't having any pain. She sat there on the bed for a little bit, rubbing her knee and trying to feel around because when we started again, as I was palpating and touching different areas of her knee, she expressed how those areas were painful. Towards the end, once we were done, she was pressing there and they were not eliciting any pain response. So that was great. She got up and was going to go and put on her shoes. She had on shorts and put on her pants. And when she got up, she started limping. And I said, "Hey, what's going on? What do you feel?" And she said, "Nothing. I don't feel anything. I'm just so used to limping." She said, "My knee doesn't bother me, but I'm so used to limping that this is now how I walk." And I said, "Okay, well, now we need to work on retraining you how to walk correctly. Because if we're not experiencing that pain, um, then we need to correct the body mechanics that have gone wrong." And that's what happened with chronic pain patients. You change so many things in your life to adapt to the pain that even if the pain is gone, now you have to retrain the body to work in the correct manner because you've been so used to operating this way. This has now become your habit. So, not only do we in physical therapy work to decrease pain, we work to improve function, improve range of motion, get you back into the game, get you back running, get you back walking up and down off the floor. But we educate and teach how to do things correctly. Because as I mentioned, and as you could see in the story, once you have chronic pain, it changes not only that body part, but your whole life because you are doing things to accommodate and limit the pain. So after you're feeling great, we need to continue to get you back doing things the right way. Because if she was to go on limping, even though she's not having pain, she'll end up causing injury, stress to another body part and having to come back and see us for something else. So I hope this helped. And if you out there are dealing with some chronic pain issues, whether it's your knee, your hip, your back, um, we specialize. We love treating patients with core issues, those with forward head, rounded shoulders, those who are sitting at a desk most of the day, those who really need some retraining of the core, some education about correct posture and alignment so that they can decrease the neck pain, decrease the TMJ, decrease the tension throughout the scalp, migraines, perhaps. Correcting your posture is a great way to improve all of those pain symptoms. And why deal with chronic pain if there's options out there for you? Seek out a therapist. You can reach out to us. Please like, subscribe so you can get our latest videos. But we also have an online course where you can go through and learn these techniques. You can do them in the comfort of your home, get some pain relief. So we are looking, we hope this video helped. We hope it gave you some insight and some direction. If you need any further help or assistance from us, give us a call. Check out our information below, and we'll see you next time. Bye.